Hey, Will.
Jake, how you doing?
Good.
Good to see you.
Yeah, it's good to see you again, my friend.
Yes.
We wanted to do this, podcast interview together and just kind of talk about a little bit what you're doing in the future and kind of some of your goals that you have set forth. But before we get into that, can you tell us a little bit about yourself and how you got into your career?
Absolutely. So I'm Will Craghead. I work as an emergency medicine physician assistant. I live here in Mesa, a couple daughters, Annie and Avery, and I'm happily married to my wife Lindsay. And we are. I got into medicine kind of by chance. I wasn't. Nobody in my family is at all in medicine, but I really liked the blend of hard sciences and helping people, and got some exposure to the medical world, and I liked the challenge that it offered. So that's why I went into medicine.
Yeah. Emergency medicine, it definitely isn't for everyone, right? So why emergency medicine? The thrill of it. What was the thought process there?
Yeah, I actually didn't really think of emergency medicine as a go-to for me. I grew up on a farm, so I wasn't necessarily squeamish at all. But once I did my rotations in emergency medicine, I loved the ability to respond to a wide variety of issues that patients may have. You never know what's coming through the door, honestly.
Yeah.
You see a lot of the same kinds of things, but every once in a while, you get this really challenging case, and I love that dynamic. So, yeah. Plus, again, the variety. I feel like I can treat a lot of acute problems, which I feel like is very valuable.
Yeah, and what's your feeling on our current healthcare environment? Are those acute problems stemming from chronic disease? Like, what's your thought process there?
That's like a 3-hour discussion on its own.
Yeah.
Yes, a lot of the things that are making us ill, and even killing us are generally chronic in nature. It goes back to even how Western medicine came about. Most of Western medicine came about to treat acute illness. Type 2 diabetes 200 years ago wasn't hardly a thing. But we got through some marvelous advancements in technology, specifically surgery and antibiotics. Over the last 150 years, we've had just massive transformation in the ability to treat acute disease, which is great because most of the acute disease now we're able to treat. We have a good track record on. In developed nations, but the chronic disease is something that Western medicine, let's say, didn't evolve to take care of, and now we have this abundance of chronic disease that is making us sick and then leading to acute problems. But the reality is that 80%, 90% of these chronic diseases are preventable.
Right. So get into that a little bit more too about
Sure.
preventing disease.
Mm-hmm.
Like what does that mean for the average person? Because obviously some people they probably have certain habits they've built up. But what's your philosophy on preventing disease?
My philosophy is still developing, but I would say my belief is that human bodies are healing machines. We have the capacity, we're born with the capacity generally to heal, mostly on our own. There are challenges that come about where we need some help from medication or other kinds of therapies, but by and away, the way that our bodies function is by solving problems for itself, mostly. It's the prevention discussion is a big one because you could ask why. Why is it that we aren't preventing? And that's a tricky one. I think that people generally want to prevent illness in their own lives. The challenge is that we may not know how. We also in Western, and this is one of the critiques often of Western medicine, is the incentives might not be there
to cure the disease,
to prevent it before it even needs curing. You think all of our health systems generally here in the Valley, have their name and then health after their name. Well, how many of those health systems monetize health? Generally, they don't monetize health. They monetize disease. They make money from disease. And that's not to say that it's not good to treat disease. It is good to treat disease, but once we're moving into the world where 80 to 90% of these diseases are preventable through changes in lifestyle, which is where we could go next maybe, but the changes in our lifestyles really is where I think the money is, in terms of, when I say money, as in that's where the high yield steps are for us and behaviors are for us as humans, to tap into that natural potential for our body to heal itself, through simple things like sleeping well, exercising regularly, eating as few processed foods as possible, having healthy relationships, minimizing stress, and avoiding risky substances. That's kind of a decent framework to think about prevention, I think.
Yeah. I think about the monetization of healthcare and the rising costs and the tide that has kind of come about. Why do you think there is such a strong rise in the cost of healthcare? And then as a side tangent too, why do you think that the providers' pay hasn't really gone up in the same level that the costs have?
Yeah. On the cost front, this is like another 4-hour discussion on its own. The reality is that healthcare is not expensive. What makes it expensive is how we pay for it. Let me explain. Insurance as a market tool is super valuable. I have insurance for my home, for my life, for my car. Insurance as a market tool is supposed to prevent me from going bankrupt if something goes wrong. Right. It's really supposed to transfer risk, financial risk, from one party to another.
Yeah.
Well, in healthcare, we pay for everything generally using an insurance product, and that's actually not how insurance is supposed to work. We're supposed to use insurance sparsely, because it's supposed to be there for higher ticket items.
Catastrophic type of situation.
Yeah. And anytime you go outside that window of how insurance is supposed to be used, you run into massive administrative costs. Let me give you an example. Car insurance. You and I have car insurance. Would you ever
an accident on the way here?
There you go. Yeah. Would you ever consider using your car insurance to pay for oil changes, or wiper blades, or new tires? No, we wouldn't, because we know what those things cost generally, and we can budget for those things generally.
Yeah.
Now, you could imagine that, let's say you had your magic wand and you could make a system like that work. You could force a system like that to work where you could use car insurance to pay for everything that is attached to your car, even gasoline. You would hate it, because you'd have to find very quickly an in-network mechanic. You'd have to go and make sure the tire shop is in network. Oh, sorry, you got denied on your new tires because there's a 1/16 left of tread on your back right. Oh, sorry, your plan only allows for one set of wiper blades every 2 years. You could see how very quickly the complexity.
It's a great analogy.
The complexity would be crazy, and you would hate it, and we would all hate it. Mechanics wouldn't like it either. They'd have to hire billing staff. They'd have to hire extra staff just to deal with the way that this is being paid for, as opposed to you just giving money for the service provided at the time of service rendered. So that's one of the main reasons I would say that healthcare becomes expensive, is through how we pay for it. However, there is a big swelling movement called the Free Market Medical Association that I'm a part of. If you want to check them out, if your viewers want to check them out, I highly recommend it. They're doing a lot of good in this world, in this area, like trying to get, because it's very complex, right? It's not just it's not just like the health systems or the hospitals. No, it's the insurance companies. It's for those who have health insurance through their employer, or for those who have health insurance, it's something like 70 to 80% of them get it through their employer.
Yeah.
And employers have a big role to play in helping innovation move along in terms of how we pay for healthcare. Brokers of health insurance products, their incentives aren't always aligned with the employer's bottom line. And so there's just a lot of moving parts that make it challenging. And then you throw on, government regulation in many ways can make it challenging to innovate. But that's kind of answers the cost thing. If anybody wants like a really good detailed analysis and kind of expose too on the healthcare billing system, they should read the book Never Pay the First Bill. It's a great book. It's called Never Pay the First Bill. It basically goes into detail about from the time you go and you're seen at the doctor's office or in the hospital, what happens behind the scenes when you give them your insurance card or what have you, and those bills start accumulating. And there's a high percentage of errors in these medical bills that people aren't even aware of. That it's just, clicking boxes and things can get lost very easily. But anyway, it's an expose into like how the billing system works. And then it's also a how-to guide of how to deal with bills that you think are erroneous. So highly recommend it. It was written by a great man, Marshall Allen, recently unfortunately passed away, but great book for anybody out there wanting to take back control and feeling like they want to understand the billing system a little bit better and have a voice or have some empowerment in that whole process, because it can feel very disempowering. You get this bill. I remember our first daughter was born at 29 weeks, so she was in the NICU.
Premature.
She was in the NICU for 10 weeks. I remember getting a bill in the mail for $400,000.
Oh my gosh.
And just look at this thing. I mean, I couldn't do anything but laugh.
Right.
I couldn't do anything but laugh, because at that point, at least I had some understanding of the medical billing system. So I knew, like, okay, well, this is just numbers on a page. And that's the other part of this too, is the sad reality in healthcare is most of us, meaning health systems, the docs, the nurses, the employers, the brokers, most of them actually kind of work for the insurance company.
Yeah.
There's that old saying, you work for who pays you.
Yes, exactly.
And
you drive towards the dollars and where they are.
Yeah.
Another question kind of in the same realm too, what are your thoughts on a system kind of like Kaiser Permanente, where it does, tend to align a little bit more, insurance provider and the ones who are giving care, right, together, so that, and two, Kaiser has done a lot of good studies. I feel like they really, because they're both, they don't have a conflict of interest as much. Yeah. It's an interesting, while not knowing that world as in depth, I love that there are forces out there trying to try something different. And a lot of this, I think, goes back to the idea of an oath. Part of a physician's oath is to treat people without respect to their ability to pay for their care. I feel like that has been lost in some ways. That doesn't exist anymore. I mean, obviously, to respect the physicians, I think that the physicians would do it, but the healthcare systems that they work for would never allow that. Yeah, and that's a can of worms, because it goes back to even state laws about being able to provide, what do they call it?
can't remember the name for it, like Good Samaritan Care or something like that, where you can then write it off. If you were to help people for free pro bono, you could get a tax incentive there. And but back to Kaiser Permanente, I think what they're doing is really cool. I think that story is still unfinished, but the idea that they're going to be in charge of the underwriting, or basically ensuring of the care that is happening in their four walls, can be very great. That they're able to see both ends of it, how things are being paid for, what the cost is, but also they have some levers to pull in terms of their internal costs from the actual care. So I think it's cool. I don't know enough about the feasibility long term of that system, but they've been around a long time, and generally, people have their complaints about everything, but generally it sounds like they're doing a lot of really good things.
Yeah. I think there is a lot of innovation to be had, especially around cost of healthcare. Is there any other details that you would give people to, help them drive down their healthcare costs? Because I'm sure on a, budgeting standpoint for people, how can they, individually, they can't change their employer and what their employer provides, but how can they, individually drive down their
healthcare? That's a great question, because we as consumers of healthcare, which we are, and it's kind of a strange way to think about it, but as a patient, when I'm on a patient side, I'm a consumer of healthcare, meaning I'm going to get a service or product and I'm going to pay for it in some way. Some of those market forces have been, totally lost, but there are still a lot of things you can do to take back some power. If you are unhappy, let's say, with your insurance product through your employer because it's just super expensive, or you're just not getting much value out of it, or you don't get, or you have to visit the Obamacare marketplace. You're not happy with that. I would look into a product called Health Shares. There are several of them, and I'm happy to get you a link for a PDF that compares a lot of them. Basically, a health sharing service or product is similar to health insurance, but they go out of their way to make sure you understand it's not health insurance. It's a sharing a pool of money.
Yeah, right.
Many of them have religious connotations, but not all of them.
Like Christian healthcare ministries.
Christian healthcare ministries have been around a long time. There's a couple more. Sedera, Zion Healthcare, been around a long time. Have a really good standing in the consumer world in terms of their ability to pay for bills. None of these guys that I've talked to several of their execs, and they say they've never had a bill they couldn't pay for, which is a very reassuring thing to hear. So that would be one place I would look. The other place that is near and dear to my heart is something called direct primary care. It's like a doctor's office, like your family doctor's office, but instead of using any insurance, you pay a monthly subscription to your doctor. About the cost of cable. And the one I'm a part of, I'm happy to plug, ARC Family Health. Worked for them a couple of years. The owner's one of my best friends, and they basically will treat most anything that you need taken care of from a primary care standpoint, and the monthly subscription includes office visits. You don't have to pay extra for office visits. It includes after hours care. So when I was working there, I would see people, keep them out of the urgent care or ER.
Right. Yeah, urgent care can get expensive in and of itself.
Yeah, absolutely. And so the other nice thing about that is it actually benefits those with, let's say, who have higher needs in medical needs, because they can get more visits without having to have the burden or, let's say, obstacle of having to have a copay and paying for each one.
Right.
So yeah, it's about the cost of cable. Kids are like $25 a month. So it's very affordable, and you're getting tangible care, which is the difference. You pay for an insurance product, you actually get zero care. Generally, you might get like an office visit thrown in there because they want to say like, hey, you got something. However, generally your benefits don't really kick in until you have, unless it's preventative. Your benefits don't really kick in until you've met your deductible, and your co-insurance and your copay, and those things have gone up significantly over the last 10 years. So, there's this other sad statistic in the healthcare benefits world. This is a couple of years, this data is a couple of years old, so I may be maybe worse than this. But the out-of-pocket cost for a traditional employer plan was so high that the employees can't even afford their deductible. Do you even have health insurance at that point?
Right.
I think no, and there's a term they had to coin for this called functionally uninsured. You know, it's over 50% of the U.S. population right now can't even afford a $1,000 emergency, which is a scary thought. And for something as important as your health, you'd like to have something that works. So anyway, it was over 41% of employees who have benefits through their employer couldn't afford the deductible, which means even if they had to use their insurance, they wouldn't be able to pay for everything on their end.
Yeah.
So they don't have insurance, basically. You know. Anyway, it's a sad reality.
Yeah. You know, I wanted to dive deeper into ARC Health a little bit.
Yeah,
and
sure.
Tell us, you know, because you know, I really do think that could really drive down cost, you know, and give people a better experience in their healthcare needs. Because I haven't been to the hospital lately, but you know, I go to my primary care quite often.
Mm-hmm.
So, you know, tell us a little bit more about it.
Yeah, thank you. I wish I had said more earlier. The office visits are at least 30 minutes generally. You can have longer office visits.
30 minutes.
Yeah.
And you guys are able to stay in business with 30-minute.
Yeah.
And I don't remember the last time my primary care spent 30 minutes.
That's part of the point is like we want to really change the dynamic of that primary care relationship and focus on the prevention. Whereas in your typical doctor's office visit, you're not going to have enough time to really go over the things that you need to address to keep you well for a long period of time. So longer office visits, we offer same day, next day visits for urgent needs. They get massive discounts on medications, labs, and imaging. So they contract with, for instance, Sonora Quest and LabCorp for labs, and they get massive discounts. You know, like you can get your typical blood testing, like a CBC, a CMP, lipid panel, a TSH, and an A1C that you get during a typical physical. It's like $28.
Oh my gosh.
Whereas if you bill those same 5 labs through an insurance company, you're looking at a few $100.
Yeah.
Same lab.
I was going to say 500. Yeah.
Same lab. Same tests. Same blood. Everything's the same. It's just how you pay for things matters.
Yeah.
Because the insurance bloat, it comes at a cost, and we're paying that cost. So that's one good example. For imaging, MRIs, people think like, oh man, that's so expensive. I gotta have health insurance for an MRI. If you use an insurance product to pay for MRIs, they become very expensive. We're talking $2,000 or $3,000. For that same MRI, if you just pay for it cash, it's like $200, $300. So the question of the day really is, why are we using health insurance for these things that we can pay for with cash?
Yeah.
Because what happens is the next year, it's becoming more and more unsustainable, because the next year, those who are in charge of that group of people on the insurance plan, the underwriters, or those who have to insure the risk of the group, they look at the group and say, oh wow, you guys had like 10 MRIs, that's a lot. We're gonna increase your premiums the next year. Yeah, there's a saying, today's costs are tomorrow's premiums, or today's claims are tomorrow's premiums. And claim meaning if you pay for the MRI on the health insurance plan, that's a claim. It becomes a claim, like you're using an insurance claim as if you need to transfer risk, financial risk. Well, $200, why are we transferring financial risk for that? Something you might need every few years, if that. Anyway, so and x-rays are like $25, $50. CT scans, $100, $200 generally. Ultrasound, same thing, $100, $200. So these things are very affordable if you go about paying them the correct way.
Right.
And people can do that right now even. So even if you have no insurance, go on to, when you go to talk to Simon Med, ask for their cash pay, and it's pretty affordable and very competitive. So Simon Med, Smile, Arizona Advanced Imaging, there's several of them that have great cash rates. So.
Right. And you said too that you guys are partnering with pharmacies too. Is that only on certain medication, generics, or what?
It depends. We have a wide variety of medications we have in-house. We can dispense from in-house.
Oh wow! Yeah.
And they're very routine medicines, blood pressure medicines, diabetes medicines, cholesterol medicine, those kinds of things, antibiotics. Then we have the ability to have them sent to your home. So we can even write one. Let's say you have to be on this medicine for a little while, but you need it urgently. We can write one for a pharmacy nearby, at least for a couple weeks, and then send mail order medicine, that medication at a much lower cost to your home and bypass the pharmacy. So a lot of different solutions there we can offer people who are members at ARC Family Health.
Yeah, that's really great. I think the focus on medication is a big thing too for you guys, right? Like that's, those people that do have those chronic diseases and have things that they need to take care of, that's an option for them.
Yeah, it can be very expensive, and some insurance products, their drug plans aren't always great.
Yeah,
and they can make no sense. Like you could have a copay for a routine medication. A copay could be like $20, and we can get that medication without a copay with anything for like $6. So you're way overpaying because that's just what the plan has as part of how they do business. So and just a lot of, we're just trying to basically, we've changed the incentives where we now work for the patient.
Yeah, because
the patient is paying us, and so we're trying to find any ways we can to deliver value through the membership, as opposed to the insurance companies. Oftentimes feels like they're not doing a lot to deliver more and more value. They're just operating how they have to operate, and their financial incentive is actually to increase the total cost of care year over year. Yeah. They have to in order to meet the demands of their shareholders because they're publicly traded.
Yeah. And I feel like the same thing with pharmacies and pharmaceutical companies too, right? Their incentives are counterintuitive to the patients that they provide care for.
Yeah, it definitely can be. And that's not to say that there aren't fantastic things happening in the world of medication. But going back to this idea of prevention, what's the old quote? I can't remember who said this offhand, but something like, "There's nothing so useless as doing well that which should not be done at all." And so we can talk about like, new meds and new this, new that, new technologies, but if 80% of the stuff is preventable, why don't we start there?
Yeah. Right.
Why don't we start helping people live healthier lives, as opposed to treating it downstream, so to speak. Mm-hmm.
Well, tell us more about that and your startup that you have just recently embarked on, because we really do want to hear about that and how that really does affect patients in a positive way.
Cool. Well, I'm glad you asked about it. My business partner and I, we've been feeling for a while that that Western medicine kind of discounts the importance of psychology and brain health, let's call it. Brain health is health. How you think about things, the experiences you've had, and how you go about operating in your life is important. We all are already part of systems of different kinds. We go to work, that's a system. We go to school, that's a system. Our families are a type of system. And so we developed this thing called Whole Life Operating System, Whole, WHOLE. And it's not just like a program, it's a system designed to help people align their daily actions with their deepest values and aspirations.
Yeah, because I have a lot of dreams, but my habits don't always follow those dreams.
That's human. That's the human nature. That is us as humans. And there's a lot of really important work that has been done on this already, going back a long time. Even a couple hundred years, if you want to cite some of the earliest psychotherapists. And it quickly turns to like a spiritual realm, actually. The word, and I learned this just recently, psyche, the word psyche, which is the root of psychology, actually means soul or spirit.
I didn't know that.
Yeah, and there's something about this soul or spirit of patients that Western medicine seems to be overlooking in a major way.
Right.
And what I think that means is we often don't in Western medicine empower people enough to pursue that which is most valuable to them. We're trained, again, to treat acute illness. And over decades and hundreds of years, you could argue, we've been the authority, let's say, to treat people with medications to help them. And that can be a really helpful thing, valuable thing. However, now it's about, are you able to make lifestyle changes to not even become diabetic or have hypertension or have out of control cholesterol, those kinds of things, right? And your sleep patterns, and what are your relationships like in your family? Anyway, whole life operating system helps people to tap into and ask questions, tap into their deepest values and aspirations, and it creates a system of accountability around that, so they can be who they really want to be.
Yeah.
And using some powerful psychotherapeutic exercises to think about themselves and their actions and their habits in ways that they probably have never thought about them before. And we didn't, we're not the psychotherapists, but we've got about 60 plus books that have gone into building this,
right?
Because we just see such a need for addressing these things, because I just don't think a prescription pad is a strong enough tool anymore. And there will be those who disagree with me, and that's fine. But going back to the idea that we are healing machines, I truly believe that we have the ability to heal and to overcome, which I think is at the root of one of the definitions of health.
Right.
And it's important for us to tap into that, as opposed to being swept by, because what happens is, if we as humans do not get this is a great quote by Carl Jung. If you don't make the unconscious conscious, it will guide your life and you will call it fate. It will direct your life and you will call it fate. There's something unconscious in us that we want to understand about where we want to go. What does my vision for the future look like? And we try and ask questions that bring that to the surface, and help that to guide people in their actions.
Yeah. I think too, talking about the subconscious and the spiritual aspect of it, I think that's been a big thing that's been lost in our culture lately, is, relying on the miracle, on your body's own innate ability to heal. There's a lot of studies too, going back to more the Western side of medicine, where we treat everything with antibiotics, right?
Yeah.
And now we've been creating these superbugs. Yeah. So I think there's a lot of thought that you guys have put into this to kind of drive in a different direction, in a positive direction towards, whole body healing versus just, and you're still wanting to use the prescription pad if needed, right? Yeah. But directing the patient to a better lifestyle.
Yeah, that's the root of what we're doing with whole life operating system. To go back to your point about antibiotics, that's a great point, because there are so many unnecessary antibiotics being prescribed, totally unnecessary. And I don't want to throw my urgent care colleagues under the bus too much, because it's not just them. It's in the ERs, it's in the doctor's offices, but I feel like what's happened is there's this breakdown in primary care. Primary care is basically the first place you would go to get care in some way. And because there's no relationship, or I should say there's a breakdown of that relationship often, because you don't have enough time with your provider, or you can't be seen for enough, can't be seen very quickly, so you have to go to urgent care or the ER. There's all of a sudden this change in the relationship, where if I don't get an antibiotic from this person because of my cold, I didn't get anything.
Yeah.
And so they feel pressure to prescribe it. They also feel pressure to prescribe it because they don't want to get bad reviews, from their patient satisfaction surveys. It's a whole change in incentive when you have a relationship with people, you say, hey, I'm not going anywhere. We'll see how this goes. You're at this day of your disease. Generally, those aren't bacterial infections. We can overcome this with these supplemental care options, and then reach out to me again in 5 or 7 days and we'll talk. So that's how we handle those kinds of things. It's about the relationship, and then this whole life operating system is really meant to address 7 domains of people's lives.
Mm-hmm.
The spiritual, which we talked about a little bit, the physical, the emotional, the occupational, financial, and did I say emotional already? Yeah,
Mm-hmm.
emotional. So we're really trying. Relational
okay.
coming from relational, how we relate to other people. Those are how we're trying to help people gain some valuable insights into how they're already operating, but more importantly, help them create a vision for their health future and their life future. What do you want? Like, what do you want? You know, what do you really? If you could have what your heart truly wanted, what would it be? What would it look like? And those are the kind of questions we ask people, and we have them write them down.
Yeah.
We do workshops. We're offering some coaching on that. So if anybody has any interest in that kind of thing, reach out.
And for coaching too, for your guys' time like that, is that fairly expensive, or what does that look like?
We are still, since we're still kind of in the startup phase, we're still trying to figure out, like, how do we make this thing sustainable?
Right.
While also, we don't want to just cater to people with money. Like, we want to make sure that we can serve a lot of people who if they can afford a cell phone bill, then hopefully they can afford this coaching too.
Yeah.
And so there's still a lot of unanswered questions there, because it feels like what we're working on is so different that we're not sure how to go about it yet. Right now, we've got some workshops next month on the 13th and 14th, which I'm happy to offer anybody who's watching this a big discount on. The coaching, as part of that workshop, you get 2 coaching sessions with us, group coaching sessions, and then it's still something we're solving for, because we don't want to have like $300, $400 an hour coaching, because that's really expensive, and it will only cater likely to a certain demographic and income threshold, which we don't really want to do. We want this to be for as many people as possible. So
and are you gonna be providing videos for some of those workshops later?
Yeah, that's definitely in the works. We want to be able to have a tier where people can just try and go through the stuff on their own if they don't want to come in to the workshop and try and work through some of the exercises on their own. That's totally in the works as well.
Awesome. Yeah, that sounds like a really good value to give to people, being able to actually confront themselves a little bit.
Yeah, and it goes back to kind of this idea that I'm a fan of psychotherapy. Like, all my clinical psychologists and marriage counselors and relationship counselors and therapists out there, like, they're doing such valuable work.
Mm-hmm.
It can feel sometimes like it's disconnected from people's health.
Yeah.
And vice versa.
The mental health of a person is disconnected from their physical health.
Totally. But it may honestly be past genetics. If you imagine this river flowing down, and down here is like what you end up being outcomes wise, and healthy or unhealthy. Past genetics is like your experiences in life, and then very quickly it's like beliefs, thoughts, and actions. It's like those things lead to, whether you know it or not, how you show up every day. And if we don't become conscious about it and proactive, it will inevitably become reactive. And so we're trying to help people answer those questions for themselves.
Mm-hmm. If you were to give advice to somebody that's listening right now, what's the best preventative care that you feel like?
I saw this quote. I don't know if I fully agree with it, but I liked it. It was, the best health insurance is in your kitchen. And I think there's some truth to that.
They say that about abs too, right?
That's right.
If you want abs,
that's right.
It starts in the kitchen. Right?
That's right. Absolutely, yeah. I'm still learning that one. I still haven't got.
Yeah, I haven't got there either.
Yeah. I think there's a lot of truth to that, but I think the best thing you can do probably to help prevent illness is to create a vision, of where you want to go.
Mm-hmm.
Because your own version of heaven and your own version of hell are out there.
Yeah.
And if you don't get real about that and understand it, then you may not even care about prevention to begin with. So answering some of those questions, but kind of the basics though from there. The basics are eating less processed foods, one ingredient foods, preferably from the earth, in their most raw and unprocessed form possible. Exercising, moving your body, however that looks.
Whoa!
I don't even like the word exercise per se. 'Cause it's like, well, it's just like move your body somehow in a way that move your body in a way that brings you a sense of satisfaction. Don't do it because you feel like you should be doing X, Y, or Z. That's generally not helpful. The word "should" is like can be real problematic. You start to feel this sense of like, is that really what I want?
Yeah.
And part of what we're really trying to do is help people do what they already want to do.
Yeah, empower them.
Yeah, but a lot of times we don't even know what we want to do. And so, move your body in ways that bring you a sense of accomplishment, satisfaction. Generally, you want to sweat a little bit. That's kind of what our bodies are meant to do too. Sleep.
No, I think one of the things with the transition of our economy in general from an agricultural type of environment to an industrial one is that we have a lot of sedentary people, right?
Yeah.
And a lot of people that are not motivated when before, an ADHD little boy would have been a great tool on a farm.
Yeah.
Right? But now he's forced to sit at this desk for 6 hours in a 5th grade class, and he's going insane.
Yeah. There's a lot of truth there. There's a lot to unpack there, but you're right, and that's something I didn't even get into. I should have. Is the idea of a mismatch, like a significant mismatch in what your body was designed to do, and how we are all operating on average in a industrialized world.
Yeah.
From staring at screens to not moving our bodies to eating these processed foods, these ultra processed, hyper palatable, meaning they like kind of hijack your taste buds.
Absolutely.
And they're designed that way because that's how these engineers want to make us eat as much of them as possible. So yeah, it's a big mismatch there, and those are at the root of what we're addressing with the whole life operating system is trying to push back against that in a meaningful way, because again, if you aren't conscious about it, the reality is, if we aren't really clear on what we value as individuals, what we do psychologically is we default to the values of those around us.
Yeah.
That's just what we do.
And then we're average.
And then we can be average. We can also, though, live a very unempowered life where you're doing stuff not because it's actually what you want to be doing, but because you're like just kind of keeping up with the Joneses, or like looking around being like, well, I guess that's valuable because they're doing it, so I'm going to do that. As opposed to really, who are you? Like, what do you really want, And I think that's one of the most empowering things you can do is start asking those deep questions of the soul. So, yeah, it's been fun so far. It's been a lot of fun.
One of the things that I kind of wanted to end on was just your outlook on healthcare in the future and what that looks like, so we can end on a positive note, because I know that we've probably hit a couple of the negatives, but at least end on a positive.
Yeah, and that's totally my one of the things I'm working on is trying to reframe things in a positive way. I hope this has been an overall positive discussion, because I think I'm actually optimistic, very optimistic about the future. When it comes to the innovation that will come about in healthcare, in other sectors, it's going to take a lot of leadership, like creating a parallel system in some ways. I don't think we're ever going to get rid of the sick care system. And why should we? We need stuff there when we really hurt or sick. We don't want that to be the primary place we go. If that's how it's operating, because that's how it's incentivized to operate. So when it comes to healthcare, I think there are going to be a lot of new ways of thinking about health and I think they're going to be very individualized, both in the medical therapeutics, like medications, but even in the way that people interact with their health. I think it's going to have to happen. I cross my fingers, both of my fingers, all the time that the incentives, financial incentives, will also change, or at least be realigned with people's health.
Yeah.
But I think that it's happening. It's only a matter of time until employers can no longer sustain 20+% renewal rates on their insurance plans.
Yeah.
And employees, same thing. So I'm overall optimistic. I think it's going to take people asking some difficult questions, like why are we doing things this way? And it's going to take some powerful leaders in all of those sectors, in healthcare, in the employers sector, CEOs and CFOs and HR directors, to say we're not going to just work for the insurance companies anymore. We're going to try and find something innovative, like doing self-funding. I'm excited. I'm excited for it because I think people really want this. Like I feel like people want something new,
Mm-hmm.
Or they yearn for something that's trying to speak to like, yeah, what it is they really want out of life. So healthcare will inevitably have to find a way to do that.
Yeah, I really do agree with you that it's going to take leadership, especially on the CEO and employer side of things, for them to want to do something different, because in the boardrooms they've been doing the same thing over and over and over. And it's going to take leaders that really care about their employees and their well-being and retention.
Yes.
Which is something that we could get into later for sure, but I think they tend to not care about that as much as they should.
Yeah, and it's a larger question I think we all need to ask ourselves as a society. And these leaders are just in a very difficult place where they have to make difficult decisions. But the question, I think, there is something like, is money redemptive? Is money the real bottom line here? And what I mean by that is, it does take a certain amount of profit to keep a large corporation afloat. But at what point is, again, the incentive there been run away by meeting the needs of shareholders, as opposed to the actual health of the patients? And so there's a health system here in town, one of the largest, where the CEO in a non-for-profit healthcare system,
non-profit, non-for-profit,
makes $30 million a year. I'm not opposed to anybody making money at all. However, there is, I feel like, some balance there where we need to make sure it's working for people and for people's health. And we're going to have to start asking some major questions about, well, do we really want health or do we want money? Because we're making tons of money, but the health trends are not great. The life expectancy's gone down.
Yeah.
Again, and that's not good. And COVID played a role, but it's not the only thing.
I think you're right. I think there's immensely talented providers and physicians that are maybe marginalized by $30 million CEOs, because if you were to put that money in the hands of some providers, they would find a way to help patients better than some of those CEO and boardroom folks would.
Yeah, potentially. And I think it goes back to the oath. This is a work of oath. This is a work of a written and unwritten relationship between us and our patients. So.
Yeah. Well, Will, thank you so much. I'm sure we can have further conversations, and I plan to.
Yeah. Let's do
it. Anything you want to end on?
I think we covered it. I think I'm excited to see what conversations arise out of this. Reach out to me. I'll shoot my email. I'll put my email in there.
Yeah.
Reach out anytime. I'm happy to have discussions about these topics. And if anybody out there is like a business guru and a startup guru and like, you know, could think of like I'm not like a business expert, so we're trying to figure out ways to structure the business to where we can help as many people as possible
Scale.
but also just, you know, do it in a way that's valuable without it being only for a certain class of demographic. So
yeah, no, I like the work you're doing, and I really appreciate your time.
thanks.
Yeah,
Thanks, Jake. Appreciate it.
that was good.